Okay, so for all of you out there suffering from back pain, and you know who you are because it is painful, we've got Dr. Gregory Yoshida, who is an orthopedic spine surgeon, here to answer all of the questions. Thank you so much for being here today.
Thank you for having me.
Well, so, you know, there are so many people with back pain, and how do you know if it's just a temporary pain or if it's something that is something serious that you need to get checked out?
Well, the good news is most of back pain in America is transient. Most are self-limited, and age 75 to 90% will be cured in 3 months. But if it's continuing...
It's a long 3 months, huh?
It's a very long 3 months. But if it's very severe, you should see a physician. Now, certain signs, take caution. If the pain goes down the leg past the knee, or any associated numbness or weakness, that takes special attention, and that should be seen sooner than later.
That could be something serious.
Yes, that could. That could possibly lead to surgery, but not to scare anyone. Surgery is only, of all back pain in America, 1 to 2% may have a surgical solution.
That would be me.
Yeah.
There you go.
About a year ago, actually.
Yeah, I get really bad shoulder pains, and one thing that I found is great is a tennis ball. You lie on the floor with a tennis ball under your back and roll around. Is that a healthy thing to do, or can you overdo that, or would you advise that for people?
That's very funny. I actually tell my patients to do that exact thing.
Oh, really?
As long as we rule out that it's not one of the serious conditions, more of a musculoskeletal sort of disorder, then I think that is a fantastic treatment modality, especially anywhere in the back, upper back, middle back, and lower back.
It's a good substitute for massage, too, if you can't afford to get massages all the time.
Absolutely.
Do you also subscribe to the same criteria for people? Some people do a homeopathic type treatment at home or try certain things first before contacting a physician. Do you use that same criteria of the pain going below the knee or the numbness to where you would want to just kind of skip over that and go directly to a physician?
Yes. If you get some of these what we call red flags, you should probably seek attention from a physician. If those aren't there, which is the majority of back pain, I don't really mind what treatment a patient does if it gets them better. There's a very famous quote by Voltaire who said, "The art of medicine is entertaining the patient while Mother Nature takes her course."
Ah, there you go.
So,
well, so entertaining the patient, is that more, I mean, should you, you know, lie in bed for a couple, 3 months until it goes away? What's the best method?
Well, that used to be bed rest. When I first started training many, many years ago, it was 1 week of bed rest with acute back pain. It shortened to 5 days by the time I finished my training. Then it was 2. Then it was 1, now it's 0. We do not recommend bed rest only if the pain is excruciating. But as soon as it's tolerable, we recommend patients get up and at least walk around the house and do gentle stretching. Get the tennis ball, heat and ice packs.
I know following my surgery, that's the first thing. They wanted me out of that bed immediately.
That is the best activity. The human organism has to move to heal.
But sitting at these sedentary jobs probably is not good for the back, and certainly not good for the shoulders, and using the mouse, and you probably have a higher incidence of problems with people in sedentary jobs, I bet.
Well, yes, it's the chairs are not designed properly, so the big buzzwords are ergonomic stations.
Right.
If they do a proper ergonomic stations, it can decrease the incidence of problems, but it does not eliminate them totally. We were not born to stare at a computer monitor and type. That is not how our body was designed. Exactly. So.
But let me ask you, Holly, because some of the things with back surgery, you know, that I'm finding anecdotally, and I'll ask you about that, but I mean, has it really helped? Because some people find worse problems after back surgery.
Mine definitely helped. I have the feeling back in my toes and a lot less pain. The pain is a little bit different now because I'm recovering, but the acute pain that I had before is, it's much, much better.
Go ahead.
Yes. Oh, it's very diagnosis dependent. With the right diagnosis, we have success rates up to 95%. Certain diagnoses, which I've found operating less on as my career goes on, it can be as low as 60, but more recent studies are showing almost under 50% with increased narcotic usage. So we are still filtering through all the data, but for the right diagnoses, spine surgery is very successful.
Wow.
Well, and what are some other things that people should be doing to, you know, really make sure that they don't get into those, you know, really critical situations?
The most important thing, and no one wants to hear this, is keeping in good shape. Making sure your weight is under control. No one has to be, I don't want to say his name, Lance Armstrong, but let's say
a gym rat.
right, but, or an athlete. But just the basic baseline tone and taking care of your core muscles, basically abdominal musculature, the low back muscles. And there are multiple programs in gyms that allow you to do these things. Pilates, I think, if you can do it, now it's not for everyone, but for the right person, that's a godsend to many of my patients.
So
I
if
find
you
it
come
very,
in,
very helpful.
if someone comes in and they need back surgery, but they have a large abdomen, do you tell them go back, try to lose that weight before you come back to me?
Well, that's a catch-22. These are patients that are immobilized by their pain and their problem, and you ask them to lose weight. What we do is when you're faced with that patient, they have to understand they're at an increased risk of a complication from surgery, just anesthesia even. If they understand that, I will operate. As long as they understand, then the rest is up to them. I can only do so much.
You can do so much, and I'm sure you do so much for so many patients. Thank you for being here and sharing your knowledge.
Well, thank you very much.
All right, and speaking of back, we'll be right back with more.